Liposuction of the face and neck can be a powerful set of procedures to help patients with facial contouring. So where this is useful is for people who have layers of fat or pads of fat underneath the skin, but immediately underneath the skin, that can be contoured to improve the facial shape. By far the most common place that we do this is in the neck and submental area, as well as along the jawline. And the liposuction cannulas can then be used to reduce excess bulk in the neck, to contour the jawline, and to contour the cervicomental angle, or the sharpness of the neck. So frequently there are other procedures that can be done along with liposuction. First, these can include skin tightening procedures like Profound or FaceTite that give some additional contour and tautness to the skin to help them show the contours that we've created with liposuction to a greater degree. We also frequently will do chin implantation in patients who may have a retrusive chin, and this can further improve the appearance of the neck and the jawline. So if you think that you may be a candidate for facial contouring or neck contouring with liposuction, please get in touch with us at Beaty Facial Plastic Surgery for a consultation.